Hello, I'm John Akers. I'm head of the School of Public Health at the Wessex Deanery.
Hello, I'm Helen Buttevant. I'm a public health specialty trainee with the Wessex Deanery.
Well, this project is all about helping people to understand public health and the scope of public health, and for those who are interested to find out how they can learn more about it. When you go to a party and someone says to you, and what do you do for a living? And I say, well, I work in public health. Their eyes tend to glaze and it's a bit of a conversation stopper. So part of the work of this project is to work out ways in which we can give people a better understanding of public health and its scope in particular, and also, for those who are interested, to learn more about it in a structured way. Well, the project's been divided into two parts, really. The first part has been about constructing a framework, a model, a population healthcare model is what we've called it. And that gives you an idea about the scope of public health and a framework to use if you want to learn more about it. Then it's worth giving a bit of time to getting an understanding of that framework, because the rest of it is rather dependent on that framework. The rest of the project is about using the framework to access e-learning materials, and the work around that has been done by my colleague Helen Buttevant, and I'll let Helen tell you all about that part of it.
So John invited me to become involved as we both agreed that there was an awful lot of existing public health e-learning resources and we really needed to search and collate them. So I used the public health population healthcare model as a framework to start an internet-based search, and I also mapped this to the Faculty of Public Health Part A curriculum to provide a topic list of subjects for which e-learning modules might be available. And my search actually listed over 150 resources that we've now stored and indexed using the public health population healthcare model to help people navigate their way through them. So our target audience is really very broad. It encompasses anyone who feels they're part of the current or future public health workforce. So that includes people like me who are public health specialty registrars, public health practitioners and specialists at all levels, but also people we work in partnership with, people in local authorities, hospitals, community healthcare workers, or anyone who's interested in becoming more involved in practicing public health. As John mentioned, we're already aware that there is an awful lot of e-learning resources in existence, but they really were from a really broad and varied range of sources, and there wasn't one single portal where people could access them. So we wanted to bring together all the existing e-learning resources into one place and produce a framework that would enable people to navigate them in a logical fashion.